Hello, my name's Adrian Richards, and in this short video I'm going to be talking about breast asymmetry, who gets it, why people get it, and in future videos a little bit about what can be done about it. So the first thing is, it's very common to have some differences between the sizes of your breast. Each side of our body is very different, each side of your face is different, and each side of other areas of your body are very different, and the breast is really no different. So minor degrees of breast asymmetry, one breast being a bit larger than the other, the nipple on one side being a bit lower than the other perhaps, are very common, and most people cope with this quite well and don't have a problem with it. When we're doing breast augmentations, it's quite common for people to sort of say, I've always noticed one side's a little bit bigger than the other, and often I will select a slightly bigger implant for the smaller side to try and improve symmetry. But these are people with relatively mild problems. Now, in some people, the abnormality is much more obvious, and even to the extent where one breast really doesn't grow at all. So there's a syndrome called Poland syndrome, which was first described by a doctor called Alfred Poland over 100 years ago, in which one side of the body doesn't develop quite as well as the other side. Things to remember about Poland syndrome are it's more common in men, but as men don't develop so much breast tissue, it's less obvious in men. So although more common, men don't sort of notice it so much. It tends to occur on the right side, more common than the left, and it's thought to be caused by a kink in the blood vessel that supplies the chest and breast area when you're a baby. It can affect the arm as well, so it can affect the chest wall, chest muscles, breast and the arm. And the most famous person who had severe Poland syndrome was Jeremy Beadle, who some of you may remember was a TV personality from some years ago, who had quite a small arm on one side. Poland syndrome varies from really mild sort of decrease in breast tissue, normally on the right as I mentioned, to more severe abnormalities, including small fingers and small upper arms and abnormalities in the chest. So Poland syndrome is rare. It's a rare cause of breast asymmetry, differences between your breasts. Most causes are what we call idiopathic, and that's the sort of medical, the posh name for saying that we don't know what the cause is. So if a doctor says the cause for this is idiopathic, it basically means we don't know why you get it. If one breast doesn't grow or is different from the other, there are a number of different options which are available, which include enlarging the smaller breast or reducing the bigger breast. That's going to correct the differences in the volume between the breasts. The other thing we need to think about is actually changing the shape of the breast. So there's two elements to the breast. One is the volume, the size, and the other is the shape and the position of the nipple and the size of the nipple. So I'm going to be talking in the next video about the various different options for surgery with each of these procedures. So just in summary, breast asymmetry, differences between your breast size and shape, very, very common. Most cases are relatively mild, but there's a whole spectrum and they can be more severe. It can be very difficult in the growing up period, and it causes a lot of distress to people, which is totally understandable. The important thing to remember is it can be treated. It is very possible to improve the appearance of your bust so they're much more symmetrical, so you look better in clothing, you don't need to disguise your breasts, and you don't need to be embarrassed perhaps showing that area off to other people. So I find it one of the most rewarding areas of plastic surgery to make people feel much more better about themselves. People who have got breast asymmetry, make them feel more normal and happier, and improve their quality of life and their feelings about themselves. So thanks very much for watching the video. In the next video I'll be discussing more in detail about the various options available for you.